5:15 a.m. The first light slips into the room as the alarm silences with a surgical precision that mirrors a scalpel's precision. I slip from the cool bed and pad barefoot to the bathroom, where cold water braces me for the day. The reflection shows dark circles from yesterday's emergency, but there's no time to dwell when two surgeries await. I brush my teeth methodically, the minty taste clearing my head as the day's demands gather like storm clouds. A hot shower loosens the knots from yesterday's 12-hour shift as I imagine the day ahead, 2 surgeries, rounds, and a department meeting. Sarah stirs awake. I lean in with a bedside kiss and promise I'll text when I'm on my way. The house is quiet. I leave a note, then descend to the car, the city already whispering outside. The drive to Mercy General is 20 minutes of focus, reviewing patient charts tucked in my mind like patient stories. The hospital is a familiar tide of activity as the antiseptic scent greets me on the elevator ride to the surgical floor. 6:15 a.m. Rounds begin with Dr. Patel and 2 sleep-deprived interns as we chart the dawn's progress. In room 412, Mr. Jenkins asks when he'll be discharged. I answer with careful optimism. We move through the floor, noting the healing incision and the steady rise of recovery for each patient. 7 a.m. Pre-op briefing for Mrs. Henderson's gallbladder surgery fills the room with gravity and plan. We discuss adhesions, anticoagulants, and the way a routine procedure carries the weight of every patient's life. 7:30 a.m. Meeting Mrs. Henderson. I reassure her and answer questions with honesty and calm. The moment before anesthesia. Trust is a sacred bond I never take lightly. 8 a.m. The first incision. I scrub in, visualize the field, and call for a precise, decisive start. Timeout is my ritual. Patient identity, procedure, site, all confirmed before the surgical map lights up. The camera port goes in. The gallbladder awaits, wrapped in scar tissue and history. 9:30 a.m. Unexpected bleeding appears. We adjust with calm precision and teamwork. We control the bleed, the field clears, and the practice of surgery proves again that nothing is truly routine. 10:15 a.m. The gallbladder comes out, diseased and thickened. It's bagged and sent to pathology. We irrigate, inspect every corner, close the incisions with care, and confirm no bile leaks. 10:15 a.m. The gallbladder is out and the specimen bag closes a tense chapter of the morning. The gallbladder's disease state is confirmed as the team irrigates and inspects every corner of the surgical field. Small incisions are closed with absorbable sutures and surgical glue, leaving the site clean and secure. Procedure complete, I announced, noting the completion time and the modest estimated blood loss. Mrs. Henderson is transferred to the recovery unit, the anesthesia team taking over as she begins to wake. I slip out of the OR, gloves removed, and feel the relief of a successful operation tempered by the day's urgency. 10:45 a.m. In the surgeon's lounge, I dictate notes that will shape records and accountability. Dr. Patel drops in, praising the intricate anatomy and the teamwork that carried the case. We review the day's plan and the next steps, balancing patient safety with the hospital's demanding pace. I text home briefly, acknowledging the long day ahead and the need to stay focused. 11:30 a.m. and department meeting discusses infection rates, protocols, and the anxious balance of progress and safety. We debate antibiotic timing and the integration of new robotic tools with careful consideration of cost and training. The conversation shifts to how new technology can support, not replace, sound judgment and skill. 12:15 p.m. Trauma alert disrupts the schedule as a multi-vehicle collision demands the full trauma team. An unconscious young man arrives with suspected internal injuries, a need for rapid assessment and decisive action. I order a fast exam and a rapid blood type cross, preparing for possible OR transfer. Then comes the call to move Mr. Chen's planned hernia repair to a later slot as the trauma needs priority. 1 p.m. Jason is stabilized and taken to OR for splenectomy and bowel repair. The splenectomy is performed with precision as a bowel injury is uncovered and repaired. 2 hours later, Jason's condition is precarious but stabilizing as we close. 2:30 p.m. In the waiting room, I speak plainly to Jason's family about the sacrifices of trauma care. I explain the reality, splenectomy, bowel repair, and the hope of ICU care ahead. 300 p.m., Mr. Chen's hernia repair resumes, a focused, efficient procedure despite the day's disruption. The repair proceeds without complication, mesh placed and incisions closed. 4:15 p.m., we finish the skin and wrap the wounds, the patient on track for discharge tomorrow. 500 p.m., afternoon rounds blend into paperwork as I check in on Henderson, Jason, and Chen. The long day ends with a lingering sense of responsibility and quiet resolve. 600 p.m., I sit to eat a lone sandwich, reviewing the day's cases and tomorrow's slate of surgeries. 3 upcoming cases hover on the horizon: thyroidectomy, colectomy, and a breast reconstruction. The city outside hums as I gather strength for tomorrow's dawn and its unspoken demands. A pause in the rhythm of the OR, and then the steady drumbeat resumes. This is the life I chose, a surgeon's balance of skill, risk, and the human stories that walk through these doors. 7 o'clock p.m., the second trauma. Page. My pager screams once more as a construction worker tumbles 3 stories and hits the ER floor with a scream of pain. I rush back to the ER, evaluating the patient as the bay swirls with EMS doctors and nurses who spring into action. The leg injury is dramatic, with the bone protruding, yet his vitals remain surprisingly stable under the neon glare of the monitors. Get x-rays of chest, pelvis, and femur, and a CT if he stays stable, as the orthopedic team outlines a plan. The CT scan clears the abdomen, a minor miracle given the height of the fall, so the orthopedics take the lead on the leg while I stand by. I return to my desk with my sandwich cold and forgotten, grateful for a clean CT but ready for whatever comes next. 8:30 p.m., evening rounds. I walk the floor one last time as families settle in, checking Jason in ICU and other critical patients. The ICU nurse gives a detailed report, and I adjust pain meds and orders, preparing for a fragile night. I instruct the night float resident to monitor abdominal girth and urine output, ready to intervene if lactate rises. This is the cruel elegance of the job, leaving patients in others' hands while worrying in the back of my mind. 9:30 p.m., the drive home. I slip out, parking lot quiet, city lights blurring as I drive through the now empty streets. I call Sarah to tell her the day's chaos and the small, ordinary things that keep me grounded. 10:00 p.m., home at last. The house is quiet. I sit with fatigue threading through every muscle. I check on the kids, tucking them in with care, the weight of the day lingering in the quiet rooms. 10:30 p.m., the middle of the night call. Jason's condition deteriorates, blood pressure drops and lactate climbs. I rush back, ordering NPO, cross-match, fast recheck, and I'm sprinting toward the OR with purpose. 11:15 p.m., emergency return to OR. A new exploration reveals a small, previously missed perforation now reopening. We repair the perforation, check for leaks, and push through the fatigue to stabilize Jason again. 2 hours later, we're closing again. The team is exhausted, but the mission is not over. 1:30 a.m., the long wait. I stay in the ICU, watching Jason's vitals, coffee in hand, waiting for stability. By 3 a.m., his blood pressure stabilizes and lactate trends down. Hope glows in the glow of machines. I call Sarah with the news. Jason is stable. I'll stay until morning rounds, then return home. 4 a.m., morning rounds begin again. Dawn light spills in as the day shift arrives, and I hand off Jason's care. I finalize the discharge notes and prepare to hand Jason's case to the ICU team for the day. 15 a.m., home again. I arrive home to the sight of Sarah making coffee, a fragile but precious reunion. I check the kids again, kiss their sleepy faces, then collapse into bed knowing I'll need rest to do it all again. 10 a.m. The day begins to rise. I drift into sleep with the promise of a new day and more lives in need of care. 10:30 a.m., the middle of the night, echoes fade as I dream of the OR and the people who depend on me. 11 a.m., the quiet aftermath. A final reflection on the calling that carries me through long hours and heavy hearts. 11:30 a.m., a moment of gratitude. I acknowledge the trust patients place in me and the families who wait. The day ends, and I'm reminded that every life is a thread in a larger tapestry, woven by careful hands and hopeful hearts.